Welcome to the Centric Behavioral Health podcast, where we talk all things mental health and substance abuse. If you or a loved one is struggling with mental health or substance abuse issues, please call our caring team now at 866-271-8480. Again, that number is 866-271-8480. To start your healing journey today. This podcast shares recovery journeys and mental health discussions. If you find this content uncomfortable, please feel free to click away and take a breather. Our goal is to share our experiences and let you know that you are not alone. Welcome everyone back to the Centric podcast. My name is Danny and I'm joined with
Jake, Director of Admissions.
I'm Tyler. I'm in business development.
Thanks, guys, for coming. So today's topic is specifically about treatment options and their importance. And I mean, we talk about it all the time here in Prevail, especially since, I mean, Jake, you basically are on the phones every single day helping people out. And, you know, can I ask you, what is the most common treatment options available for mental health?
For mental health, what you have is you'll have inpatient, which is mental health residential, which is very important. Could be, especially if they're not on their medications. If they're suicidal, whatever it may or may not be, they need to be in a safe environment, speaking with a therapist, getting medications that are something that they need, you know what I mean, because they have a mental health disorder. It's something they didn't choose to have. No one wants to have it, you know what I mean? So it's very important to have the acknowledgement from inpatient, from the therapist of what you have and how you can treat it to live a better life, because you're going to have mental health for the rest of your life. This is able to get you into the facility, get you better. So when you leave it, you have the tools and everything to keep going and keep getting better.
That's awesome. And then, Tyler, what are some of the treatment options that are available for substance abuse?
So, fortunately, in Florida, there's obviously more resources than other areas. I would like to say most places do have at least state-funded resources, but some don't. And if they do, they're bare minimum. So I can't say that everyone has things, because I haven't been everywhere, and I don't know if every state has state options. I'm sure there's always some sort of hospital setting or something. But as far as, you know, the other types of options, there's obviously private and inpatient, outpatient, you know, different levels of care, different length of stays, different types of treatment. You know, it depends on what exactly the individual might be struggling with.
It's basically a case by case.
I would say it's case by case, but I would say most states offer at least some sort of state-funded treatment or private as well. So there's definitely both in a lot of areas. Just I don't know about all of them, because some have minimum resources, like the Louisiana, the Alabamas. Those, it's very, very limited.
So currently we're here in Florida, speaking on behalf of Florida rehabs. You know, and especially being here in Prevail, it's like, is there a difference? Have you my question is, have you ever been to a different treatment center other than like here in Florida? And then, like, you know, how does that kind of compare?
So I've been to multiple facilities in Florida. The biggest thing that you can tell from each facility is the staff and how they treat you. That is the biggest thing from each facility. You can have 5 facilities, they can all run and do the same thing, but each 5 has something different to them. And most of the time it is the staff. What is staff willing to do? How much time are they giving you? Because there are, you know, the beds might be the same. One facility might have 15 beds, one facility might have 80 beds. That's a big difference. You know what I mean? To be in there with 15 people and then 80 people, you know what I mean? How much time is that individual going to actually get? And I feel like it is very important, especially when you're looking for treatment, trying to pick out a treatment, what's going to be the best option for you with your situation that's going to get you the time and attention that you need. So I've learned that from, you know, over 10, 11 years ago, being in multiple facilities. The last one was just good for me. And they were family oriented. That's why it worked for me, to be honest.
And that's kind of how it became the last one for you, essentially. Yeah.
Mm-hmm.
So how do they kind of stack up? Because I know that there's certain levels. It kind of starts from me, and I'm going to talk with a substance abuse perspective because I know that there's the difference between
For sure.
mental health and
Of
substance
course.
abuse. How does it stack up? Because some there are more intense ones than other ones. Can you describe those?
So, can you describe it a little better? I'm sorry, but
Yeah,
as
yeah.
far as like, what kind of difference are you looking for? Like, because if go ahead again, just re-ask the question again.
Yeah, yeah, for sure. Or well, like,
Like, what do you
just
mean? How do they stack up?
so
That's what I'm
like,
trying
how
to.
are the different levels of care? Because
Hmm.
I understand that, someone who's just coming in from detox,
Hmm.
um, and they're just starting out, and everything's kind of new. That's where you're getting a little bit more of an intensive care,
Mm-hmm.
Yeah.
versus as you're doing your steps, as you're getting better, then there's a different level, and a different programming, essentially. So can you explain like those
The
steps?
transition,
Yeah, all
kind of.
those transitions.
Yeah. So typically, someone would start in like, well, for substance abuse, it would be like a detox
Mm,
residential facility. Usually, someone's detoxing. I don't know, a week, 10 days, 2 weeks. Depending on whatever they were taking.
mm,
Sometimes they can stay in residential for 30 days. It might be 2 weeks to detox, another week or two in residential.
mm.
By that time, they might be stable enough to step into the outpatient, which would be PHP, IOP, OP.
And can you explain what PHP IOP is?
Yeah, so PHP is you just come here for group hours 9 to 3.
Mm,
It's typically an outpatient setting. Obviously, certain programs have different models. I guess some have housing, some don't.
mm,
That kind of varies on the program. Obviously, PHP is what with or without housing still looked at as outpatient. So after detox residential, usually you would step down into a PHP, which is a partial hospitalization program, which would be like another short term month and a half, 6 weeks stay,
mm,
transitioning into IOP or OP, which would be 5 times a week, 3 hours a day, 3 times a week, 3 hours a day,
mm.
once a week, 3 hours a day. You know what I mean? It could look
Right.
different for each case. So,
But I think now, like, my next question is a little bit more into like your personal stories. Specifically, like, I mean, this question is, what were your it says what were your favorite treatment plans during your recovery? But I guess I could probably ask a little bit more easier, just like, how was, like, in short, how was your journey kind of through treatment? When you first started, what were your feelings? What was like your initial, like, going into it versus during, and what were like some key points? I'll split it up a little bit better.
Well, it depends on which treatment state you're talking about. Because
Okay.
right.
I have
So
different
that's it.
ones. I can go to the first one. I can also tell you about the last one. You know what I
Okay.
mean? On what I felt going into it the first time and the last time. Like the first time, I mean, I'm 31. I went to treatment the first time when I was 19 years old.
Mm,
For you to tell me that I'm an addict or an alcoholic was not easy. You
mm,
know what I mean? It wasn't. So I went to treatment. I went to groups. I did all that. I stayed clean and sober for a little bit. And then, someone told, I just tried it. Just smoked weed. Next thing you know, I got done smoking weed, and 48 hours later, maybe 24 hours on crack.
mm,
9 months clean and sober, weed went to crack like that. The last time I went to treatment, which was July 14th, 2014, and
mm,
last time I've had a drink or a drug, I haven't. It was way different. I took it serious. Like when the therapist told me to do something, I did it.
mm,
You know what I mean? I was tired of living how I was, so I was willing to take the suggestions they were willing to give me. If I
mm,
want to go be a doctor, I have to go to school. I have to get a degree. It could be 8 years. You can't shortcut that and still be a doctor. You
mm,
can't just say, hey, I'm just want to do this part of it, screw the rest of it. It's okay. Like I can still be a doctor. No, you can't. Like if you want true sobriety and true recovery, uh, you need to listen to the people that have it and everything before you. So last time in
mm,
treatment, I listened to the therapist. I still had fun. I mean? It wasn't boring. It wasn't, I mean? There was a pool, there was a beach. It was great. But I
mm,
took my sobriety way different. You know what I mean? I wasn't looking to leave
mm.
after 7 days, 14 days, 30 days. I was willing to stay as long as I had to where I was able to be on my own. And that was the biggest difference for me, was just willing to listen and willing to take suggestions and actually do it.
Was there a point, because like sometimes it's like, yeah, like your story starts off where it's like, I'm not really gonna take this seriously, a relapse and all this, but could you recall maybe that like eye-opening moment where you're like, I am going to take this seriously?
My eye-opening moment was when I was at the airport. So my dad was taking me to the airport, and my mom drove 15 minutes because from the airport to her house. And when she walked in, my mom looked at me, and my mom started crying, turned back around. And I have never seen my mother cry. So that right there was, to me, like, maybe I am as bad as what like people think. Like, for my own mother that came and looked at me in the face, and I'm her youngest, that was eye-opening. Like, all right. And I looked at my dad and said, I'm never going to do this shit again. And I haven't looked back since. That was the biggest eye-opening to me. I've never seen my mother cry. I'm 31. I've still never seen her cry. She's never cried in front of me. So that right there was eye-opening to me.
So then after that, it was like you took everything seriously. And did you go through multiple more treatments, or was that like the start of the last treatment?
That was the start of the last one. I did detox and res. I did PHP and an IOP. So combined was like 4 months of treatment. I think so. I was in treatment for like 4 months. Yeah, combined for the last time.
And how many years are you now sober?
10, a little over 10. What are we in September 2024? So I'm 10 years and 2 months. July 14, 2014 is my last one, and will definitely continue to be my last one. I will never do this again.
Yeah.
Ever again.
No, and it's like every time I live like. I mean, because I guess I'm more of like the normie, I guess, in this group, but it's like it's always amazing to see kind of like when you guys celebrate your sobriety, when you it's almost like a birthday party.
Yeah, it's like another birthday.
Yeah, it's like you're
it's like a reborn,
born again.
Because you are born again.
Yeah.
I mean, when you're doing drugs and alcohol, and then when you get completely off of them, get clean and sober, you're two totally different people. It's the only thing in the world where you can live 2 lives in one lifetime. I lived a life of being a drug addict. I'm still a drug addict, but I mean like actually actively using, stealing, lying, cheating. I did all of that, and now I don't live that anymore. So 2 lives in one lifetime. You know what I mean? It is 2 totally different lives. Totally different lives from what it was to what it is now.
That's fantastic. And Tyler, same question to you. It's my questioning was a little bit weird in the beginning, but to get the gist of it, it was essentially the same, where it's like your story when you entered into treatment, how you felt going through it. And I don't know how many times you went through treatment, but can you tell a little bit about your story?
So I would say pretty similar to Jake. The first attempt, I was not interested. I didn't take it seriously. I thought I had it figured out, just like most 18-year-olds, right? Obviously, it was short-lived. I failed miserably quickly. And that lasted for a little while. And then I put together a year when I was 18. And then not much work was done in that year. I just kind of, white-knuckled it all year. And I ended up relapsing after that year. And then I had a bunch of treatment stays in those next couple years. I don't know what happened. I just remember overdosing really bad the last time it was the last time I used, but I overdosed really bad, and I was in the hospital for days on a bunch of machines and stuff, and my mom came. I remember just seeing like the devastation on my mom's face, and I was like, yo, something's different. Like, I got to do something different. And that was really it. That started like the initial motivation behind me wanting to do something different. Obviously, a ton of work followed that, of years and years of sober support and sponsorship and programming and everything else. But that was like the initial, like, what am I doing? Like my mom's over here. At the time I was 22, pretty much dead, right? My other siblings are married with kids, college, graduates, whatever. And I'm like, I got a trash bag that she was sitting next to. That's all I had was my mom and the trash bag. And I'm like, it's time to do something different. So that last time I went from the hospital, a couple days later, I went to treatment from the hospital. Kind of like Jake said, at that point, I was like, yo, I'm sitting down, shutting up, and whatever you guys say, I'm willing to do it. There's no rush. I have no timetable on how long I'm going to be in here. Like, you guys tell me the recommendations, and I'm willing to hear them out. And I started listening, and I just kind of got around good people. The program I was in at the time let me find a job prior to leaving. So that was super helpful for me because it was like, you know, I was in the program still. I was working, going back to the program. They helped me save a couple of hours to move into sober living. And then I was able to snowball it from there. I just kept going, just never quit, you know?
Yeah.
That's pretty much how it went.
That's, yeah, like it's almost, it's like you really, I mean, seeing your mom and her reaction to
Yep.
you, just like Jake, where it was like that,
It's almost like
just
a
seeing.
spiritual internal light that like is a switch, like a light switch. Just like, man, whatever I got to do to not do this no more. Like I'm willing to do whatever it is to not keep doing this because it's like we've had the years and years of drug use, right? So you're not missing no fun. You know what you're signing up for. It's super played out. It's for the birds, right? You're just consumed because you don't know anything else. So it's easy to do the same thing over and over again when you're not familiar with doing anything else. So I feel like that was a lot of the reason why I kept getting high. I felt like I had no purpose. So until I felt like I had purpose, I just kept using because I didn't know what else to do with myself. Because I was like bored and shit. Like I just would get high.
Yep.
Just because you're just unfamiliar with doing normal stuff. So I would just keep getting high. And once I kind of like, once I knew there was more purpose internally, that there was like more to life than the drugs and bullshit like that, that's when I was like, all right, whatever I got to do to like dig out this hole, man. Just here I am.
And here you
I got
are.
8 years in November.
8 years, 10,
Yeah.
10 years. Wow.
November.
I mean, it's really fantastic to hear your stories. I mean, just like going through in that aha moment hitting you in the face.
Yeah.
Can you recall a moment during your recovery when you realized, oh, well, no, never mind. You answered that question. Were there any challenges that you were facing during your recovery?
Whew. A lot. How do I put it? I was raised in Ohio, but I grew up in Florida. What I mean by that is because I was so young, like I didn't know how to do anything. So everything was a challenge. Like I had to grow up. Like you had to get a job, you had to pay bills, you had to do your own laundry. Like mommy and daddy's not there, you're not getting high. So learning how to like grow up and go through what really is to be a grown up, financials and everything, times were tough. Sometimes you just want to like give up. You know what I mean? You're not making that much money. You know, what's the point of doing this? And that happened a lot, you know, in the beginning and everything for me. But each day got a little better. And then you know, I remembered that to be honest, like nothing on the outside is going to make me happy, so I have to be happy. Like it doesn't, and that right there is like it didn't matter how much that person was making. If I can make that same amount of money, it's still not going to make me happy. So I had to work on me being happy and realize the only thing I need is food to eat, a place to stay and pay some rent. I need nicotine because I just need it, and I needed some caffeine, and that was it. And then like I was okay with that, and then each day got better. But like it's not, you know, everyone wants the instant gratification of right now, you know what I mean? And that's not how it's going to be. But I learned to be happy with just making a certain amount of money and come home and not spending it on drugs. You know what I mean? And actually going to do that. Relationships as well have put me in dark times as well because you feel every single emotion that you can think of when you don't do drugs and alcohol. And that was something for me, like when it came to relationships, really was tough because like before I just get high, you know what I mean? Like if you hurt me or if I did something, I'm just gonna go get high and numb the pain and then just forget about it. Can't do that no more. So you have to really, really feel the emotions of it. That was tough for a long time. Just learning the emotions and the roller coaster of it and
just
talking to people.
While you're going through it, it's like you're, you know, I mean, having different coping mechanisms. Instead of going directly to that drug, you're like,
oh yeah,
you know, you have to now find a different way to kind of soothe yourself.
That's almost how it is. It's really finding a different way to get out of your head, whatever it may be, talking to somebody. Because no matter what, everyone's been through something that you've been through. Like I'm not special. Like, oh, I went through a bad relationship. So did 40, 50,000 people in the world. You can talk to somebody about it. You know what I mean? And that's what I learned is you just got to pick up the phone, dude. Sometimes just talk to somebody about it and just get it out of your head.
Tyler, same to you. So what kind of challenges did you face during recovery?
I mean, I would say to piggyback off of kind of like where Jake was leaving off. I mean, I think I've dealt with a little bit of all of them at some point in, especially early on, financial, just even being okay with being alone by myself, being okay with myself, being okay doing nothing, being okay being bored. You know, you kind of got to get used to being bored, doing nothing,
Would you
being
say?
okay with like we're so used to chaos and like we're so used to having like a gazillion things going on in our life and in our head that like when we're in active addiction, it's like all day you're just back and forth, back and forth. Eventually, even when the drugs go, for a while you're still, you know, you're firing on all cylinders up there, and like you got to kind of just. It takes a long time, but it takes a while, but you got to kind of take a step back and like kind of be able to breathe, be okay with being where you're at in life, even if it's not where you want to be. You got to know, like, you know, kind of like Jake said, like the turtle wins the race. There's no easy shortcut. It's just slow and steady, you know, and like you gotta buy in, you gotta believe it, you gotta be okay with where you're at in life, and you gotta be okay with sacrificing things, and you know you're willing to work towards your goal, right? You know, it's pretty similar, you know.
Would you say like then boredom, I guess, to an addict is like the worst thing that could
Yeah, I would
possibly
say it's just
happen?
dangerous territory. It's
Yeah.
just like most people aren't okay with doing nothing, and I
Mm.
feel like once I was okay with doing nothing, a lot of my problems went away
Mm.
because I don't. There's not always something for me to be doing. You understand? And then
Yeah.
in those times I'm not doing anything, you should enjoy it. You should, you know, maybe go play with your animal, be home, be
Oh, I
present
almost.
with family, be, you know what I'm saying? Like
Yeah.
all the shit we missed when we were in active addiction. Like there's always stuff. It's just I don't know. I feel like once I was okay with being by myself, bored or not, alone or not, a lot of my issues started kind of going away because I was internally happy. I was okay with who I was. I was, you know, I started to find out things that I really enjoyed, not what I thought I enjoyed. You
Mm.
know, as I turned 30, it kind of changed. Like you would, you know,
Mm.
I don't know. I feel like your interests change. Your interests change. You're okay with not doing nothing. You're okay with maybe going fish for a little bit or
Yeah.
something that you probably wouldn't have done in when you were 18 or 20. You get what I'm saying?
Yeah.
So
Yeah, no, for sure. I know like sometimes with like young brains, all we want to do is just,
go, go,
live
go,
our
go.
lives and
Well, you feel like you're missing stuff.
yeah.
Like if you feel like if you're not doing something every day, you're missing something.
Mm-hmm.
So once you let that go, half your problems go with it because that's not real life.
Mm-hmm.
You're not missing nothing. Everyone's doing the same thing everyone does. We all wake up, go to work, go to a meeting, go home, go to the gym. That's it. Day's over. It doesn't need to be more confusing than that.
Yeah, and I mean sometimes it's just like we need to appreciate almost the boredom. Like
Right.
in times like that, a lot of times with like mental health and all that, we do things like self-care.
Mm.
I mean, some things to just kind of like recharge our batteries, just to kind of like focus on ourselves, like look inwards. For me, like I personally love to do like art, like I'm always painting and drawing, and it's more just a personal hobby of myself, but it recharges my batteries. Like, what do you do to recharge your batteries?
Fish.
Fish.
Fish?
Yeah.
Yeah.
I learned
Fish.
patience with fishing, and it's very, very important to me. Is learning patience. I've never had patience. I'm an addict. My father's never had patience. My brother's never had patience. My sister's never had patience. So it runs still. And that's why my dad, anyone you say fishing, like, no, I don't want to do it. Why? Because they'll say it's like boring, but like I've learned to appreciate one, the fish, two, the beautiful lake, three,
The
when the sun
peacefulness, the
rises, the
quiet.
peaceful and the quiet of it, to actually realize that like I'm all right with it and I enjoy it. You know what I mean? If you would have told me that 20 years ago, I would have said like 15 years ago, I would have said you're effing out of your mind. I'm not fishing. It's not who I am. I have to be active. I have to do this. I got to do something. You know what I mean? I grew up playing sports. It's the same exact thing. I grew up playing basketball. Basketball's faster than football and baseball. And I quit baseball. Why? Because I needed the speed. I needed the up and down, and I couldn't learn or I couldn't just be okay. And with just fishing, it brings peace, quiet to my mind. You know what I mean? Just to throw the bait out there and see what happens. I can do it for hours.
Yeah, it's definitely like a pressing pause or pressing like the slow motion button, like just for a brief moment of time.
Yep.
So that's wonderful. Um, let's see. I think I have only a few more questions. I kind of asked most of the bulk of the treatment questions. My last question here is, what kind of advice would you offer someone who's seeking treatment today?
Huh.
Go today.
Yeah.
The sooner the better.
Go today because tomorrow isn't promised.
Yeah.
And I've been on the other end of that phone call. Promise you I have. So like anyone that calls and say like, I don't need to do it today, I can do it tomorrow. You might not get tomorrow.
Yeah.
And that's the realization of it. I don't care if it's mental health or substance abuse. If you're mental health and you're suicidal, you need to go get help. It's not a game. It's not a joke. Because you might wake up tomorrow and your kid might not be there anymore. You might give me a call and say, hey, sorry, little Johnny passed away last night, whatever it may or may not be. So like if you're struggling, you want help, you need to go today.
Yeah.
You're not better than anybody. Everyone struggles with mental health or addiction. I can name you 15 celebrities, famous people, millionaires that have either died or struggled with addiction. That doesn't make them it's how it is. You know what I mean? If you know anything about basketball, Delonte West was literally homeless in Florida and went to treatment. He was an NBA basketball player, played with LeBron James, homeless in South Florida. It's not a game. It'll take anybody like that, and it'll take you down to a dumpster quick.
And it can happen to just anyone.
Anybody.
It doesn't matter who you are.
There's no exclusions.
No exclusions at all. And everyone's willing and everyone deserves to have a chance at sobriety.
Yeah. I mean, and if you call in today, Jake might be one of the ones to answer your call. Here I will add like a little like edit thing here where the phone number is to call. And I'll also add all of the information down in the description below for anyone out there who really needs treatment or is just kind of curious about it. But honestly, like they're saying, call. Just give us a call, even if you're just curious or want to know more about treatment.
Even if it's just for information.
Just for information.
It's just good to know.
Exactly. Yeah. Exactly. So with that, I want to thank you guys for joining me on the podcast.
Of course.
And yeah, so anybody out there who is seeking treatment, just give us a call.
Absolutely. Bye. There you go.